Doctor, we've talked about calcium a little bit, and I think we've established that taking those antacids with calcium is not a great way to fend off osteoporosis. Can you talk about what might be a better way, a better choice to help that condition?
Absolutely. With 31% increased risk of heart attack death shown in large studies of women taking plain calcium. Now again, you can decrease that risk 10% by adding vitamin D, and I think if you add magnesium to that, you'll eliminate the risk. But calcium is a small player. A much bigger player, and a wonderful way to treat osteoporosis, would be the mineral strontium. Strontium, I'm not talking about the radioactive strontium people hear about from the nuclear bombs. It's a safe, healthy mineral. It's cheap. It is 170% as effective as Fosamax or other medications that are standard use for the osteoporosis. Now, the problem with Fosamax and related medications is that after 5 years, they cause more bone fractures than they prevent, and they become toxic. And that data, as is often the case with medications, this data that the medications will kill you somehow doesn't seem to get public until right around the time the patent on that medication expires and it goes generic. And then it just bubbles to the surface. Huh? It's just this remarkable way it seems to be. And that's what's happening now with the Fosamax type medications. So if you want to prevent or treat osteoporosis, number one, walk. Body again has you use it or lose it approach. If you walk, your body says it needs stronger bones, and weight-bearing exercise will improve it. Number two, strontium, 340 to 680 milligrams a day. Again, almost twice as effective as the medications. They're cheap. Number three, you want to supplement, and I like a product called OsteoStrong, which is a mix where you get the vitamin D, the calcium, the magnesium, the vitamin K, boron, the silicon. You get a host of nutrients that build bones. So I have people take that in the evening and the strontium in the morning, because the vitamin D, calcium, and strontium affect each other's absorption. Strontium in the morning, OsteoStrong at bedtime. Mild osteopenia or bone thinning, 340 milligrams of strontium. If it's severe enough that you're on the medications, 680 milligrams. And you'll find study after study after study after study after study, double-blind, long-term placebo-controlled studies have shown the strontium to be not just highly effective, but highly safe and increases bone density while decreasing bone fractures. Wonderful, simple alternative. In addition, bioidentical hormone replacement.
For osteoporosis?
Yes. For men, you'll see osteoporosis often comes from low testosterone occurring, and we talk about menopause, but how about menopause, you know? And in women, the natural estrogens, now again, low dose is fine. You don't want to use the synthetic pregnant horse urine poison pills. Those are nuts. You use a good bioidentical like Biest, and we're finding that we can get by with much lower dosing. It used to be 2.5 milligrams was recommended. Now we're just finding 1/10 of a milligram or 1/4 milligram. Tiny, tiny dosing. Protects the bones, and I think keeps people very young, very late into life. And the same with bioidentical testosterone. Now that it's a prescription that doctors can prescribe, they're giving it out like candy, but as usual, they're giving too high a dose. 25 to 50 milligrams is plenty, not the 75 to 100 that the drug companies are going, you know. Here's trick or treat, give it in the candy bag, you know. But a simple trick for people who don't have insurance. If you have insurance to pay for your medications, get the prescription one. All the estrogen patches are bioidentical. Prometrium is bioidentical, the testosterone, but they're expensive. A nice simple way to get the testosterone is your holistic compounding pharmacy who can make it in a cream at a tiny fraction of the cost.